project this PPT correctly for the second part of our okay. It seems that the projector is working. Oops. It doesn't work. Why it doesn't work? I don't know what is going on here. But anyway, you can see my projector. You can see my PPT, right? Oops. Let me just use my mouse to have this projector moving on here. I don't know what's going on, but like this, it shows correct PPT projecting. But now here, I don't see what's going on here and here. And it should be all right now. Hold on a second. Oops. What's going on? Okay. Let's start the second part of today's talk. The second part is the vital signs and the anthropomorphic data that are also the important contents that we need to record for our everyday clinical work. Vital signs. What are the vital signs? So what's going on here? There are 4 vital signs. The first one we need to record is the body temperature. The internal body temperature is tightly regulated to maintain normal cellular function of the vital organs, particularly the brain. Every person has different temperature baseline, so record the patient's temperature at each visit. So these are maybe different things, but body temperature may varies from time to time. So we need to record the patient's temperature from each visit. They may have different temperature, especially for the COVID-19 pandemic period. We need to measure the body temperature again and again and again every day. So what is the normal temperatures? Diurnal variation of body temperature is what we call variations of the temperature during the day. The minimal temperature will be identified at 3 a.m. to 4 a.m. in the morning. And the highest, also what we call the maximum temperature, will be identified at 8 p.m. to 10 p.m. So these are what we call diurnal variation of the body temperature. Also, we will see simultaneously temperatures in various regions of the patient's body. The body temperature can be measured in the rectum, in the mouth, in the ear, the axilla, or the groin. We always measure temperature in the axilla, but nowadays we use digital temperature measurement, like a gun, to measure the skin temperature from your forehead. So these are different locations of the body parts that we can take body temperature. The normal body temperature is anything lower than these figures. First of all, we need to know the definition of fever. If anything from the oral temperature exceeds 37.5 Celsius degree is what we call fever. But if you pick up the temperature from the rectum of the patient, anything exceeding 38 Celsius degree is what we call fever. And for the axilla temperature, may be lower. So if we take a axilla temperature above 37.2, the patient may have fever. So if we identify a COVID infection patient, we need to take 3 times for the temperature. If each time the patient has a temperature exceeding 37.5, this may be suspect for a fever, and then we need to do the further examination for other tests. And the second vital sign is the pulse. The first one is the temperature, and the second one is the pulse. What is pulse rate? What is the volume, as well as the rhythm? We usually palpate the brachial or radial pulse. The brachial here, the radial pulse, because they are easy to access. The normal pulse rate and rhythm. A normal person, they will have 55 to 100 beats per minute pulse. And if the patient has a pulse lower than 55 BPM, this is what we call bradycardia. If the patient has a pulse exceeding 100 BPM, this is what we call tachycardia. I mean, the patient in quiet situation, not running, doing exercise. And this is the background to measure the pulse, okay? So anything lower than 55 or exceeding 100 may be abnormal. And respirations. At rest, the normal respiratory rate in adults is between 14 to 18 cycles per minute. And if the body temperature 1 Celsius degree increase will cause 4 cycles of respiration per minute added. So if the patient has a basic respiration rate about 14, and the patient has 37 degree, but if the patient has 38 degree, the patient may have 18 cycles of respirations. So every Celsius degree increase of the temperature of the body temperature will cause 4 cycles of respiration added. So this is what we measure the respirations. And the third vital sign, the fourth vital sign is the blood pressure. The first one, the temperature, the pulse, and the respiration. And then the fourth one is the blood pressure and pulse pressure. And this thing, you need to master this technique to measure the blood pressure, so that this is the must test thing you need to grasp. We measure the arterial blood pressure using the indirect method. External pressure is applied to the overlying tissues, and the compression necessary to cool the artery is assumed equal to the intra-arterial pressure. So this is the mechanism for using the indirect method. We use the external pressure to cool the artery. The pressure applying to cool the artery is assumed equal to the intra-arterial pressure. Let's see how to perform the blood pressure measurement. The sphygmomanometer consists of a flat rubber bag enclosing a cuff of indispensable fabric or plastic. We have two different types of the sphygmomanometer. And this is the black rubber bag enclosed in a cuff, in this cuff. A rubber pump inflates this bag with air, and this tubing connects the pump to the bag and to the manometer. So there are several parts of a sphygmomanometer. And also this thing is also a pump, the gauge here, the tubing for connecting the pump and the cuff. And this cuff, we need to wear the cuff at the arm of the patient. So how to measure the blood pressure and the pulse pressure? Measurement of the brachial artery pressure is the organ location that we use every day. Record 3 readings. For example, we have 3 readings like this: 130, 80, and 75. 130 is the systolic blood pressure. 130 is where the sounds appear. We pick up the first sound, and the reading at the first sound appear is the systolic blood pressure. And the second sound, the second change we can pick up is where muffling occurs. We will hear a very strong pulse sound, pop, 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 like muffling occurs like pop, 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 whoop, whoop, whoop. And this is the change. When the change occurs, this is the second reading. And then the third reading is where the sounds disappear completely. You can pick up the sounds like pop, 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 whoop, 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 whoop. And then when the sounds disappear completely, the reading is the diastolic blood pressure. So there are 3 readings you need to record. And these are the mechanism for measuring the blood pressure. And this is the axillary artery, like this. These are the brachial segment, brachial artery. We put the cuff here and pump the air into the cuff using the connecting tubing. And also this tubing is connected to the manometer. We put our stethoscope on the radial artery location here to pick up the sounds, like the first sound appear, the muffling, and the sound disappear. If we pump the air into the cuff, these are the illustration for the artery open status. When we apply the pressure and pump the air into the cuff of the sphygmomanometer, it will occlude the artery. The lumen will be closed. And then we need to release the valve. When you release the valve gradually, to a certain extent, you will hear the first sound. the first sound you can pick up indicated that the artery will open when the first sound heard. And then this is the systolic blood pressure. And then pop, 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 like the muffling occurred. This is the second reading. And after that, the whole sound disappeared completely. That's the diastolic blood pressure. So these are 3 readings, and also the mechanism for the sphygmomanometer, how we use this equipment to measure the patient's blood pressure. And this is important. And this is the method for measuring the blood pressure you need to master, and you need to know how to do it, and you need to know the mechanism of how we use this foreign pressure to measure indirectly for the blood pressure of the patient. Okay? And the second part, after the vital signs, the 4 vital signs, now you know body temperature, the pulse rate or the heart rate, as well as the respiration, the blood pressure are the 4 vital signs of the patient. It will give you basic information of the patient's status. Before this, besides this, we also need to pick up the anthropomorphic data of the patient. The first thing is the height. In some pathological situation, the patient will have short or high stature. Short stature indicates a failure of growth hormone production, decreased tissue receptivity, or impaired nutrition. So we may have some patients have a very short stature. Also, we have accelerated linear growth. This can only occur before the epiphyses are closed in late adolescence, and is a result of increased growth hormone from a pituitary gland tumor. Let's see, what is this? This is the excessive height, like this guy on the left. This is what we call acromegaly. Actually, we have some athletes suffering acromegaly for playing basketball and playing volleyball and something like this. The patient may have excessive height. And this is a disease that can involve many organs all over the body, such like the front lobe bruising, and the patient may have a vision defect, enlarged noses, enlarged tongues and lips, and also the patient may have cardiomegaly, hepatomegaly, nephromegaly. All things are enlarged in the body, all the organs. And also the patient may have polyps in the colon and carpal tunnel syndrome. These are the excessive production of growth hormone in the body. So the patient may have excessive height and also have excessive production and then growth development of the organs. So this is the acromegaly. And besides the height, the patient may also have abnormal body proportions. On the upper hands are the normal hands, but if the patient have Marfan syndrome, the patient may have elongated finger and arm bones, just like a spider. These are the abnormal body proportions, what we call Marfan syndrome. We know some very famous volleyball players, they have Marfan syndrome and suffer the cardiac disease and have sudden death, suffering Marfan syndrome. So They may have excessive height, excessive elongated body parts. These are the disease situation. Also, some situation, the patient may loss of height. Decreased height after reaching skeletal maturity can only result from loss of long bone length, loss of cartilage in lower extremity joints, loss of vertebral height, loss of intervertebral disc spaces, or excessive spinal curvatures. These are in the elderly patients. They may loss of height, resulting from all of this, like the bone, like the cartilage, and also the vertebral height, also the intervertebral disc, and excessive spinal curvatures. We can see this in the elderly patients. Besides height, we also need to measure the weight of the patient when we admit the patient in the hospital. Like there are some different situations the patient may gain excessive weight or weight loss. We can see growth retardation, cystic fibrosis. This is the disease situation. The patient may have weight loss, but if the patient had weight gained, we need to measure in both situations, both the loss or gain of the weight, we need to measure the body mass index, what we call BMI. How to measure the BMI like this? We use the weight divided by the height square. So these are the index to see if the patient have obese or malnutrition or some other disease status. Like I told you guys before, the mental status, the psychiatric and social evaluations are also important parts to evaluate the patient's status. We need to see if the patient have abnormal perceptions, abnormal affect and mood, thinking, abnormal memory, behaviors, for disorders or other disorders. We need to talk to the patient. During your communication with the patient, you may identify this situations. Gait. What is the gait? Observe all three phases of the gait for walking like the gait. We need to observe touchdown, which should occur with the lateral heel stance, which should be centered, and push off, which should come off the great tone. Next, have the patient walk away from you on the tones and observing from behind. Turn and walk towards you on the wheels, observing from the front. So both from the front and from the back to see the patient walking, to see if there are some abnormal gait. And besides the height, weight, the gait, and we need to examine the skin for the patient. Like these are the skin coloration, abnormal skin coloration. The color of the normal skin results from a blend of 4 pigments, like melanin, which shows brown color, keratin shows yellow color, oxide hemoglobin shows red color, and reduced hemoglobin shows bluish red. So these are the normal skin color, is a blend of all these 4 pigments. If the patient shows paler, the patient may have anemia, and the patient shows the cyanosis. This may be excessive accumulation of reduced hemoglobin. The patient may short of oxygen, and the patient may have suffering cardiac disease, showing cyanosis from the skin around the mouth. These are the pathophysiology situation. And also they have some specific clinical occurrence that we need to know. Changes in skin color. Some situations, the patient may have constitutive diffuse brown skin. What we call acquired diffuse brown skin is the mannerism. This patient may show a diffuse brown skin, such as also the hemochromatosis, have excessive iron accumulation under the skin and also in the other organs of the body. If the patient shows a blue-gray color, is what we call argyria. This is the silver accumulation. Also, if the patient have acquired diffuse yellow skin like this, there are two situations. One is the jaundice, which may be indicative of liver disease like liver cirrhosis or obstructive of the biliary tract. The patient may show jaundice. And the other thing is the carotinemia. So this patient may have excessive keratin in their blood. They will show diffuse yellow skin. So jaundice and carotinemia, the patient may show diffuse yellow skin. Okay, let's see what is erythema. Often accompanied by increased skin temperature. Its borders are not discrete. These are the erythema. Besides this, we may see some patients have deep pigmentation. Some patients may have hyperpigmentation. You may need to read your textbooks thoroughly to identify what are the diseases that can induce deep pigmentation and hyperpigmentation. I'm not going into the details here. And also the skin moisture. We need to examine the patient's skin to see if the patient has dry skin. They may have the loss of body fluid. Then the patient may have dry skin. Decreased skin turgor, like the elasticity, decreased skin elasticity in the elderly patient or in the patient with dehydration, like the skin turgor decreasing. Evaluation of the skin turgor can help us to prescribe adequate amount of liquid to infusion into the patient's body when they have dehydration. So the skin turgor is an important thing that we need to check. And also these are the skin eruption. There are certain skin lesions like maculas. Maculas are not palpable, and they may be desquamation or scaling. These are what we call maculas. And the second thing is the maculopapillus. It's slightly elevated portions of the lesion, like this. These are the maculas. These are the maculopapillus. And these are the papillus. It's solid, elevated, and less than 5 millimeters in diameter. So there are different definitions that you need to know if you are going to be a skin doctor. Okay. Okay. What are the plaques? The plaques are more than 5 millimeters in diameter, usually from confluent papillus. But if you identify a nodule like this, is often solid and elevated, extended deeper into the dermis or the subcutaneous tissue. It's greater than 5 millimeters in diameter. This is what we call nodules. And also we can see wheals. What are the wheals? They are circumscribed, irregular, relatively transient, often seen in hypersensitivity to some foods or hypersensitivity to some drugs. So these are the views. Vesicles. Vesicles like this. This the accumulation of fluid covered by a translucent epithelium and easily punctured to release the fluid at less than 5 millimeters. These are the vesicles. Pools. Pools are the accumulation of fluid and larger than 5 millimeters in diameter. Is what we call pooling. And sometimes we can see the accumulation of pus, and then we call this pustules. These are the vesicles or puli filled with pus and tiny abscess. And also, we saw this in our clinical work. What we call this is the vegetations. These are the patients infected from some virus, especially papillomas virus. And the vegetation are elevated, irregular verrucous or papillomatous, like this, okay? These are the vegetation. And scales, partly separated dry cone-filled epithelium clinging to the epidermis is what we call scales. The clinical occurrence for the scales are the psoriasis. Psoriasis is an autoimmune disease often seen in the psoriasis patient, and they may need to use the immunomodulator, also the biologicals or the steroids to treat the psoriasis. Also, we can see some intradermal hemorrhage like this. This is what we call petechia. These are also round, discrete, less than 2 millimeters in diameter. These are the petechia. And if the petechia enlarge, larger than 2 millimeters in diameter, this is what we call ecchymosis, like this, ecchymosis. And when we see larger ecchymosis, we call this purpura. Hemorrhage of either side occur in groups. These are the purpura. Purpura, 紫癜，中文称紫癜，瘀点petechia 瘀点，ecchymosis 瘀斑in groups. These are purpura, what we call 紫癜。Hematoma 血肿 like this. Underlying hemorrhage causes elevation of the skin or mucosa. What we call this is hematoma. Okay, these are the skin lesions we need to know the name of these skin lesions. They may be indicative of different pathological situations. Arterial spider, like this. These are the small arteries, have different branches. These are the central part. If you apply some pressure to the central part here, you can occlude the small artery in the center. And then all these surrounding branches will show pale in color. And this shape is just like a spider. And this often identified in liver cirrhosis patients. Shows the dysfunction of the metabolism of the hormone. So these are the arterial spider. Also, the palmar erythema, like this, is also an indication of liver dysfunction. And this patient, we often call this cancer, palmar erythema. So both the erythema of both 鱼际肌, palmar erythema. And sometimes we need to examine the skin of the patient to see if they have some scars. This may form after injury, leave alterations in pigmentation, and they will give you some stories. The patient may have injuries of the body part or may have some previous surgery history. So you need to examine the scars of the patient in their body. This will give you some history. And these are the skin examination. After all of this data, we need to do the lymphatic system examination. These are also important. Examination of the lymph nodes are the must-test part. The following characteristics should be noted: the lumbar size, consistency, mobility, tenderness, warmth, and whether they are discrete or matted together are important characteristics that we need to record for the patients of the lymph nodes. Palpation of the cervical lymph nodes are important. There are different groups that you need to remember in the cervical region of the palpation for these lymph nodes. Submental lymph nodes under the chin, in the midline, and on either side. Submental lymph nodes. Submandibular, mandibular here, the mandible bone. Submandibular groups of the lymph nodes under the jaw and near the angle of the mandible. Jugular. Jugular is also what we call the anterior triangle, along the anterior border of the sternocleidomastoid muscle here. And this is the triangle for the anterior triangle group of lymph nodes, jugular. Supraclavicular group, supraclavicular here, behind the mid portion of your clavicle. These are the supraclavicular group of lymph nodes. These 4 groups, and then there are 5 more. The 5th group is the poststernocleidomastoid lymph node groups. Also, we call this posterior triangle behind the sternocleidomastoid muscle, and here, and also the upper part of the clavicle, behind the posterior border of the upper half of the sternocleidomastoid muscle, and this is the posterior triangle. And also, we need to examine the post-auricular region. Post-auricular, behind the pinna of the mastoid process, behind your ear. These are the post-auricular group of the lymph nodes. And also the pre-auricular group, slightly under the occiput, pre-auricular under the occiput and in front of the checkers of the pinna. This is the pre-auricular, okay? Pre-auricular group. The 8th group is the suboccipital group. Here, like in the midline of the occiput and to the either side. So these are the suboccipit group of the lymph nodes. And then the 9th group of the cervical lymph nodes is the pretrapezius. Pretrapezius is in front of the upper border of the trapezius here. These are the pretrapezius group of the lymph nodes. And then you can see the figure from your textbook. And then these are the important things you need to remember. How many groups? What are the names of these groups of the cervical lymph nodes? And then I will tell you how to do the palpation. We need to do the palpation of axillary, infraclavicular, and supraclavicular lymph nodes, besides the cervical lymph node examination. The supraclavicular lymph nodes, we have the also the axillary region. The axillary region here, axillary region, we have different groups in the axillary region. The central group, the natural axillary group, the pectoral group, the subscapular group, and the infraclavicular group. Also, we need to perform the supraclavicular group. These groups are also included in the cervical lymph node. So we just not looking at this group. But these 5 groups, the first 5 groups are from the axillary region. In the past years, I will perform this lymph node examination and using real models from you guys. But today we have this online lecture, so it's a pity that I cannot perform this physical examination using a real model to show you guys how to examine the central group, the lateral axillary group, central group, lateral axillary group, pectoral group, subscapular, and infraclavicular group. So there are 5 groups in the axillary region. Palpation also the shallow lymph nodes all over the body. Besides the cervical region, axillary region, we also need to do the inguinal region examination for the enlarged lymph nodes. So these are the palpation of the lymph nodes. And the important regional lymph node syndromes, we need to pay particular attention to the post-auricular nodes, pre-auricular nodes, submandibular nodes, and submental nodes. These are the nodes draping for the draping region for the ENT disease. If the patient have the infection from the ENT region and also the respiratory region, they may have enlarged lymph node in this post-auricular, pre-auricular, mandibular, and submental lymph node enlargement. And for research, we often perform inoculation of the lesions with regional lymphadenopathy disease. We may take some exudates from these lymph nodes or do the puncture of the lymph nodes and use these exudates and these specimens to inoculate into the animal to see what kind of infection this patient suffered. So these are the importance for lymph node examination and sometimes to get the specimen from these lymph nodes. And the key points, okay, last but not least, these are the key points for this lecture. We need to know the normal value of the body temperature and the pulse, the respiration, and the blood pressure. And we need to master the measurement of the blood pressure and to grasp the examination and the palpation sequence of the lymph nodes. So these are the key points or take-home messages that you need to practice again and again with your classmates or with your friends. And when you have the chance to come back to the school, I will show you how to perform this examination. And we also have the small class lectures later on. Today's lecture is all here. Thank you guys for your attention. And if you have questions, please feel free to put your question for the message board. I will answer your question as possible, as what I can do. Okay. Thank you again for your attention, everyone. See you later.